And then here we have where the patient is prepared from. Yeah.
Named Dr. Rita Mosa Transplant Theatre at Lubaga Hospital is a facility ready to perform organ transplant.
Council to come designate us and say you qualify, we shall start transplant activities. Regulated by the transplant law that was signed by the president. A transplant costs about $17,000 to $30,000 US, depending where you go. We are hoping that by the transplant services coming home, it's going to be cheaper because there will be no travel, there will be no exorbitant professional fees by the surgeons, and it will be a regulated environment. The quality of services will be very high because we shall be working initially with our partner institutions in India and in Turkey for a while.
And for us who trained, especially for us for liver, we came back, for me came back in 2018, but we're about 10 surgeons, but most of them are in Mulago. But what we have agreed through the Society of Uganda Gastrointestinal Endoscopic Surgeons, where I'm the president-elect, is we are going to form a team. Because right now, as a country, we are starting from zero. So we're going to form a team, and it's that team that is going to work together to make sure that we do transplants in the country.
There are now 2 hospitals, Mulago, a public facility, and Lubaga, private, awaiting accreditation by the Organ Transplant Council to carry out organ transplant procedures. The Director General Health Services at the Ministry of Health, Dr. Henry Mwebesa, confirms that the ministry is putting in place the Organ Transplant Council as required by law.
Of course, they have to go to cabinet for approval, but it will be in place within about a month because people are ready. We have here Lubaga ready, we have Mulago hospitals ready. Also, it has applied to be accredited. The first private hospital now, which has applied to be accredited. So we are ready to go with one public hospital and one private hospital.
The Archbishop of Kampala, the Right Reverend Paul Semogirire, says such facilities will ease access to organ transplant services and reduce on the costs of traveling abroad.
Those who are able, the rich ones, the wealthy, have been able to go to Dubai, to London, to India, to America, Canada, and other countries, including Kenya. But those who are not able enough, didn't have that opportunity to do it. Now that we put this facility here, I'm happy and confident that everybody will be taken care of. We shall ensure that there is no preferential treatment. We make sure that the rich are catered for, but also those who can afford, moderate afford, can be assisted to come and get assistance by acquiring new organs or functioning organs.
The demand for organ transplant is growing, and the Director General Health Services at the Ministry of Health, Dr. Henry Mwebesa, says on average 5 people are cleared in a week to travel abroad. Adiana Kote, UBC.
And then